Hey guys, welcome back to Ask an Expert. I am sitting here with Dr. Anzola. I cannot wait. We are at Temple, which is a holistic wellness hub here in Houston. They have so many incredible service offerings and I can't wait to dive in with you today. So I would love to kind of start with a little bit of background about you and how you got into like the holistic integrative wellness space, because it's something I've been interested in for years and you're an expert at it. So I'm curious kind of what piqued your interest and got you interested in studying this in school.
Yeah, so it's really interesting. I went to UT Austin and I was pre-dental. I wanted to be a dentist for the longest time that I could remember. But when I was in school and living in Austin, I was exposed to a lot of like natural alternative medicines, and so I started to like change my thoughts on just learning more about big pharma and the exposure and the education. And at the same time, my grandpa got diagnosed with cancer. And I remember it was really hard for my family because there was nothing they could do for him. And they told him, you just need to take chemotherapy. And they didn't give him any like diet recommendations, like nutritional advice. And I was studying nutrition. So I just was like, this is not right. And I started getting really frustrated. And so at that time, I was like, I want to focus on the whole body. I want to help people holistically. And there's another way. And so I started interviewing a lot of people in my field. I interviewed naturopathic doctors, acupuncturists, holistic dentists, and I just wanted to get to the bottom of it. Like, what's the best way for me? And so then I picked acupuncture and integrative medicine, and I'm so happy I did, because here in the state of Texas, we can get licensed, and we're licensed by the medical board. So as far as having it as a career, like it's a very sustainable option.
And we spoke a little bit before, and you were saying how whenever you first started studying it, it wasn't as trendy, and now it's kind of getting to be more trendy, which is honestly amazing, because I think people are learning to sort of try and prevent disease instead of wait and be, what do you call it when you're not
when you're sick? You're like, you become chronically ill.
Wait and be reactive to it, right? And treat the symptoms later. And so I think that that's so cool that you kind of were like way ahead of it.
I was ahead,
And now you have this incredible business that has so many offerings that are so cool that I can't wait to try like every single thing. I want to start with acupuncture though, because that's your specialty and what you do. So whenever you do acupuncture, does it hurt?
You don't really feel it. And a lot of times I do it on people, especially for their first time, and they're bracing and they're like, it's already done. And I'm like, I already put some in. And the needles are extremely thin. They're as thin as a strand of hair. And so sometimes in the pictures you can't tell that, but it's really thin and bendable. So essentially you don't feel anything.
That's great. Doesn't hurt at all.
And everyone's really pleasantly surprised.
I love
and
that.
I always tell people, if people do this to relax and for stress and anxiety, it can't be too bad. Right. Like, it can't hurt
and
too
that's
bad.
the thing too, is like I think that's people's fear sometimes with going. It's like, oh, needles, I don't like needles, don't want to do it. But if you can't really feel it, So as far as acupuncture goes, is there a different type of needle that you use for your face versus your body?
Yeah, that's a great question. So we use Serang needles. They're made in Japan. They're the highest quality needle on the market, which is very different than maybe a lot of other acupuncture clinics. And on the body, they're very thin, very gentle, but on the face, they're even thinner. So there's specific needles that we use on the face that help to prevent any bruising. It's just very gentle because the skin on the face is more delicate.
And what's the difference between the Japanese needle and other needles?
So the Japanese needle that we use is the Serang brand, and it's coated in silicone. So it's very, very gentle, and it almost like glides into the skin, where other needles from like China or Korea, they're stainless steel. So they're a little bit more rough. So you notice those needles when they go into the skin.
That's good to know. That's amazing.
So here it's very gentle.
I love that.
Thank you.
So how does it work exactly? Like, how does acupuncture reduce stress or make you feel less stress? Like, is there, how do the needles going into your body, I guess?
What's going on? So it works on your nervous system, which is really interesting. And when we put the needles in, we're stimulating your nervous system, and it puts you into this parasympathetic state of rest and digest. And the nervous system sends signals to your brain, and your brain responds, and your brain releases endorphins, so the feel-good hormones. So usually after acupuncture, people leave and they feel like they're floating or relaxed. So that's one of the ways that it works.
Yeah.
Other ways is it helps to stimulate your blood circulation, decrease inflammation, among other things. And then in Chinese medicine, how we explain it is we're rebalancing your qi, your energy. So the medicine's 6,000 years old. So terminology was very different than it is now.
Yeah.
And so they talk a lot about like qi in your body, and if you have like qi stagnation, like where the energy's stuck, what acupuncture does is it helps to break up that energy and move it so that you can energetically be rebalanced again.
That is incredible. So how do you know if someone's energetically stuck? Do you kind of feel it? Do you like a sense for it, or do they come in with a certain problem and you can kind of tell?
Kind of both.
Okay.
So the medicine's very much based on observation. So as soon as someone walks in the room, I'm looking at the color of their skin, how like bright their eyes are, because that tells us like how their spirit is. Like, are they happy? Do they feel good? How they walk?
Yeah.
So we start observing like right away the sound of their voice even. And then during the visual diagnosis, we also look at the tongue and take the patient's pulse. So the tongue is a muscle that you can see on the outside of the body. So we use it in diagnosis all the time. So we can tell how hydrated someone is, how rested they are, if they have just a lot of mucus and inflammation in their body, how irritable or anxious they are. So I always pair what I see in the tongue diagnosis, with their overall diagnosis, getting to the root cause. And then the pulse is another diagnostic measure that we use. There's 27 different ways that we can feel someone's pulse. So I'm not counting the beat. I'm feeling energetically, how does the blood move through the body? Does it peak high? Is it moderate? Is it deep? Is it thin? Is it fast? Is it slow? So that's like a really quick indicator to check someone's overall energy and see how they're doing. I can feel how their digestion is, if their hormones are off. Menopause pulse feels very different than, perimenopause or when you're younger and your reproductive years.
That's so incredible. That's just from feeling
the pulse. Yeah. So I'll feel the pulse, and then I ask more questions. I say, do you sweat at night? How's your sleep been? Have you been feeling bloated? And everyone's pretty surprised.
Yeah.
They're like, yeah, how did you know? And I'm like, I feel it in your pulse.
Yeah. That's incredible. Yeah. So that's one of the ways you can kind of help diagnose someone or help them kind of figure out where they're energetically off is when you
it helps me fine-tune my own diagnosis. Because when we're treating like two things, again, maybe fertility, and the pulses feel different. So I know what herbal medicine to do, like what the root cause is, you know?
Yeah.
So is it someone that has too much of something like fibroids or cysts? That would be like too much. The pulse would feel a lot stronger. Or is it someone who has a weaker constitution, like hypothyroidism? Blood flow is a little bit poor, and that pulse would feel a little thinner and a little bit weaker. So they feel completely different. Then we treat them differently.
Great. Wow, that's incredible.
Yeah. That's
so much you can do. I love it. And really give them an overall view of their body, how it's doing. Yeah.
We spend a lot of time with our patients, especially the first visit. I'm 30 minutes in the room just like analyzing and assessing. I had a guy patient come see me, and he's been in and out of like doctor's offices for the past 2 years. And when I assessed him, he told me that was the first person who ever actually looked at the color of his skin and asked all of these important questions. And he was just mind blown. He said, after seeing so many doctors, like no one ever asked me that. Like, why is that? You know? So we want to dig a little deeper to understand like you.
Wow.
Everything.
It's
the
so
liver.
Cool that you can do that.
It's really interesting.
Help with that. I'm so big on energy too, and I feel like that's a major part of just daily, like getting through life easier, right? It's like figuring out, okay, where am I kind of stuck? How do I heal this part of me and keep going? So I think acupuncture's got to help so much for that. And I see that you treat, I saw a lot of posters in there of like pregnant women. So kind of like, how does acupuncture help during pregnancy? Is it safe during pregnancy?
Very
and then
safe.
how does it help during pregnancy?
Okay, acupuncture is very safe during pregnancy. I work with a lot of fertility too, which we'll talk on. But once the woman's pregnant, we can work with them from like day 1 all the way into birth. And so we just break it up into trimesters. So during the first trimester, we're working on the symptoms, unwanted symptoms of like morning sickness, fatigue, even preventing miscarriage. So if the woman's spotting at all, we give herbal medicine. We have a protocol to help her keep the baby in. And then second trimester, usually people are feeling good.
Yeah.
Sometimes there's like little kinks of like aches and pains or whatever, and so we address that then.
Yeah.
And then third trimester, we're working at helping you to be ready to deliver.
Yeah.
And then on the other side, it's a lot of calming points, because if it is your first time too, you have a lot of fear, or you might be a little like resistant to like the unknown, like what's going to happen. So when we get to the third trimester, I'm really talking and asking them like, is there anything that could be holding you back? Why the baby's not coming, you know, or anything that you want to process or work through before the baby comes. And there's points to help release that stuck energy, you know, like fear or worry.
And that's something that I think people don't typically ask pregnant women, which is kind of crazy, or just in life in general. We're not really trying to dig deep into some of those things. We're just moving through life day to day. And it's like, there could be things that are preventing that from happening, or there could be reasons why you don't feel good, or why this feels a certain way. And I think that's so cool that you kind of dive into like the body as a whole, right? Absolutely. And that's what I like about this kind of medicine too, because I've been reading a little bit about big pharma and all that stuff too, and it seems like in Western medicine, it's a lot more siloed with the different parts of the body. So I think it's so cool that you kind of, you know, can assess everything mental too, right? Because mental is huge, and sometimes it gets ignored and you're just treating symptoms. So I think that's cool that you kind of dive into that and help out, right?
Yeah, everything matters. And that's why like we're root cause medicine.
Yes.
Because like sometimes the root cause could be fear.
Right.
You know, especially if you're looking at like giving birth.
Yes.
And so for us, like that's just as important as the physical.
Yeah.
Like mind, body, and spirit.
That's incredible. I love that. So how does, you mentioned a little bit herbal medicine. How does that play a role? We'll start with the pregnancy part. So how does that kind of play a role in pregnancy? Like you mentioned fertility, and when we were walking through, you had mentioned doing something with herbal medicine to help fertility. So what is that, and kind of how does it work?
Yeah, so the herbal medicine we use is very potent, but some things that you might be familiar with, like ginger, cinnamon, dates, but we use it in a potent way. So it's 5 to 8 times more potent.
Okay.
And so when we give this to a patient, it is very medicinal, right? It's helping the body to improve certain areas, like for fertility, like helping with blood flow, blood circulation, uterine health. Every formula is different, and the thing is about this medicine, because it's root cause, if 2 people come in for fertility troubles, they're going to get 2 different treatments because their bodies are different.
Right.
And so they'll get 2 different types of herbal medicine. Yeah. 2 different acupuncture protocols. Yeah. But yeah, herbal medicine.
Very personalized, it seems, right? So with the herbal medicine, how is it a pill, or is it like you put it under your tongue? Is it liquid? How does that
So here I use pills and tinctures.
Okay.
Just because it's the easiest way to take the herbal medicine.
Okay. Is a tincture just a way to you mix it in with that, and then you mix the herbal medicine in with that, and then you put it in your mouth? Drop
so
it
usually, because it's really strong and herbal, you put it in like a cup of tea or water, and then you drink it. Okay. Yeah, because the herbs are preserved in alcohol. Okay. So you could put it in your mouth, but it'd just be a little bit strong.
Got it. Okay.
Yeah, it's a little herbally, but most people have an easy time to take it. The ones for fertility are usually sweeter, so it's not so strong.
Oh, amazing. Yeah. So what are the other, outside of like pregnancy and fertility, what are the main things that you see people for and you use herbal medicine? Is it kind of everything, or
Generally anything, right? Okay. Like I know we talked earlier about like headaches and migraines. I have really good herbal medicine for that.
Amazing.
For
I needed
pain
that
in the body.
when I was postpartum so bad.
Yeah, and it's really effective, and it's safe and natural, right?
Yeah.
For anxiety and stress, for sleep.
And so they're all kind of different, and you just, based on the person, like say you had sleep and migraine issues, you would kind of make
I could combine it, yeah.
Oh, that's so cool. So are they just taking one thing, or is it like 2 separate?
So say someone came in for like sleep and migraines. It depends, because we have 2 different types of sleep. Like one is more sedative, one is more gentle, just helping to like rebalance the body at the root cause. So we could combine the 2. Yeah. And it's case by case. Yeah. But then that way you kind of knock two birds with one stone.
That is
that we're
so
trying to hurt birds.
Yeah. Yeah.
Save two birds with one net.
Right.
I don't know.
There you go. That's a good.
There we go. Yeah.
Okay, so I have another question for you about that kind of is more on the lines of nutrition. So I saw online that you do holistic nutrition as well, and it looks like you do the blood work here. So say I do blood work. I've done blood work before, and I recently did like a ton of different tests. If I bring that to you guys, that's something you can look at?
Yes, absolutely. So either myself, Dr. Sebastian, or the nutritionist can look at it, which is, her name's Fran.
Yeah.
And if you're working with the holistic nutritionist, from there she sees like what levels are off, and then she creates suggestions for you. So we don't necessarily like to put people on diets because diets are not sustainable.
Yeah, that was going to be one of my questions actually. I was going to ask about, is it like a diet plan or is it just suggestions or meal ideas?
Yeah,
or
we're all about sustainability.
Right.
And so when you can make lifestyle changes, then that's going to be better for you in the present and better for your future self, right?
So true.
For wellness, So it's all about just helping you to learn.
Yeah.
Because we're huge on education and empowerment.
Yes.
So just educating our patients, helping them to understand like what's good for their body in that moment, and then supporting them. So supporting them through the changes.
That's
and that can look different for everyone. And I know Fran does give out like some recipes because my dad's been working with her and she's been so great for his blood sugar imbalances. Yeah. And so she's given them like some really good recipes and juice recipes, and just like she's really supportive. And there's an app that we use where you take pictures of your food and you communicate like throughout the day with your nutritionist. So it's extremely supportive. You don't go home feeling unsure about what to do, which sometimes in the doctor setting or medical setting that can happen right where you leave and you feel like
and you can be really gung-ho about something when you first leave or you first hear about it or you have the idea, but then life happens, right? It's like, oh, I'm busy, I'm gonna get or like I'm gonna grab this thing that I see in my kitchen, I just need to like eat fast and go.
It's hard to implement.
And it is hard to implement, and I think it's hard to implement long term. That's also why I love that you do lifestyle, because even I'm like anti-diet now. I'm like, it's not sustainable. It's not something, I don't think it's good for mental either. I think it's more about, like you said, lifestyle, and it's a lot about habits, right?
I agree.
So things you can get yourself into, and having someone to support you is so cool. Like
it's
through
a
it,
changer,
right?
Yeah.
Like when you go home, I didn't even know that you guys do that.
Yeah.
That's cool.
Yeah, when
So
you have someone who like believes in you and encourages you, life looks a lot different. Goals are more attainable.
And they understand your problems or what you're dealing with on a deeper level than probably anyone else does.
Yeah,
for
sure.
So that's amazing.
Absolutely.
That's so cool.
Yeah.
So with the holistic nutrition, I know that you also do acupuncture for digestion. And I've seen so many GI doctors over the years and never really been able to figure it out. And I know a lot of people struggle with like just general IBS or bloating or cramps or just general like stomach discomfort. What do you do for people that are having digestion issues that are not exactly resolved or like figured out?
That's a great question because I've also been through that myself. So me and Fran, we work together with our patients. So usually they're seeing her to really understand and deep dive into the testing on what's going on in the gut microbiome, what is really off. And then I help with the symptoms and them to feel better, just like on a day-to-day basis. So there's points that we do on the abdomen to help release like the gas and bloating for pain, improve bowel movements, and then some calming points with that. And it's very effective. I have had people who couldn't have a bowel movement for many days, and then after the treatment, they go home and they have a bowel movement, and it's it's a total game changer when it comes to digestion. And then we give herbal medicine too. And that helps.
So it's kind of, like
it's
holistic, right? It's everything. It's the nutrition, the acupuncture, the medicine, lifestyle, I'm sure, like changes and things like that. Reducing stress, I'm guessing, is probably a big
thing. One. Yeah, stress, and then the food here too. Like there's a lot of additives in the food. Or
oh my gosh, that's something I've been getting into so much recently, especially with having kids and having my son. Like now I'm just hyper aware of what's in food and kind of just learning and like educating myself on it more than anything, because I think that, like you said, that's why I love your practice, because you're all about educating and making sure people understand. I do believe people have to like want it to change, right? So they've got to know. It can't just be someone telling them. So I think it's like you being educated, me being educated, understanding, you know, what's in the food or what my blood work says, or that will motivate me to do the change probably more than anything.
Absolutely.
So I think that's really neat and incredible.
Thank you.
I also wanted to dive a little bit into holistic skincare because I see that you guys do that some
so
here.
fun.
So what exactly does that entail? Like, what is holistic skincare?
Yeah, holistic skincare is natural, right?
Yeah.
And here what we do is we do acupuncture facials. So, and we do face mapping.
Okay.
So when someone comes in, say they have wrinkles or blemishes on the skin, observation, right? So we look at the skin, we see where the wrinkles or the acne is, and then we tell them about what might be going on internally, because your face is a representation of your inner world. If you're stressed, if you get angry easy, if you cry and you're sad a lot, you get these wrinkles. So I'm able to tell them a little bit about like their life and what maybe they've been through. And then from there, we work on it on the inside, right? It's holistic. So we do acupuncture points to break up that stuck energy.
Yeah.
And to help support, of course, collagen, blood circulation, overall decreasing stress and tension, like in the face muscles. And then we do points on the face. So the points on the face, sometimes we're threading needles, like threading wrinkles, if it's a wrinkle that they're trying to like work out, or just help to plump the skin.
It's amazing. So you can help with the wrinkles. That is so cool. I didn't know that.
Yeah, we're like the natural Botox.
Yeah,
right?
that's amazing.
Yeah.
How cool.
Yeah.
And amazing that you can also, like, you can still do those kind of facials or the acupuncture facial when you're pregnant.
So usually not. Yeah,
okay.
It's too stimulating, and when you're pregnant, you have extra blood, and so it's easier to bleed and lay on your back. So for all the mamas, I tell them just like wait until after the birth and then like treat yourself.
I know the reason I'm asking that is because you can't do any of that stuff, and I always wonder, like, if someone could do something, they might feel better. But if it's too stimulating, then you don't want to do that.
Yeah, but education. I'm happy to like teach them how to do gua sha, so they can do it at home.
You guys do gua sha here as well, right? And facial cupping.
And
you
facial
said?
cupping.
What is facial cupping?
Facial cupping it's a suction that we use. We have small specific cups that we use on the face, and it just helps to promote blood circulation and decrease tension. So it's really good for getting rid of like puffiness or tightness in the skin.
I gotta try that. Does it leave like a mark?
No.
Because you know, trained. Like some of the, I don't know, my husband does it and I'm like, oh my gosh, they're like dark.
On the body, like that's kind of what you're going for.
Yeah.
On the face, we don't want to cause any bruising.
Right.
So I use a lot of arnica.
I love arnica. Arnica's amazing.
Yeah.
No, I love it. That's awesome.
Yeah, so with the face, there's like so much that we can do. And then we also, like for a general acupuncture facial, we do acupuncture on the whole body and on the face. With the red light therapy, we have Saluma. And then after that, it includes the facial cupping and gua sha.
I love my red light therapy.
It's so good.
So after I had my son, I struggled with eczema all of a sudden. I'd never had eczema before, and suddenly postpartum started getting eczema. And I love that you do holistic skincare. So what's your approach to like eczema and treating eczema?
Yeah, it's so interesting because like when you give birth, like your hormones and everything shifts.
Yes.
And then in postpartum, can be, I don't want to use the word stressful, but challenging time in your life. Definitely. And so it's oftentimes we have more inflammation in our body and our gut health is off because, you know, we tend to worry more, we're eating different because we're just eating what's available or the quickest energy foods that we can get. But oftentimes we look into the gut. So eczema is one of those things that we tackle holistically. Yeah. So you would work with the nutritionist to see in the gut like what's going on. And then from a Chinese medicine standpoint, we call it damp heat. So it's heat and inflammation in the body, usually in the gut, that's manifesting on the skin. Yeah. So how we treat it is by using acupuncture points to clear inflammation and clear heat, and then also treating it locally. And sometimes, you know, stress can flare it too. So doing points just to calm me, working on the nervous system. But I have I had one patient like a few weeks ago. Immediately after, she was so surprised that like the eczema on her hands was like 50% better. That's incredible. She came in, it was really,
eczema is almost, I swear, impossible to get rid of when you're having a flare up. That's how it feels to me. Like I can do anything and it just certain amount of time and it goes away. But that's, if you can do that, that is incredible.
And it's one of those conditions that it's like when you see a flare up, it bothers you and it stresses you out more. Yep. So then you have that component of like playing tug of war with it. Like I'm getting really frustrated, it's back, and then that makes it worse. And it's just like a cycle.
Especially when it's on my face. I'm like, oh,
Yeah.
on my face again. And it's itchy and it's uncomfortable, you know, so you're kind of like
yeah.
frustrated with it, right? Which doesn't help. But
Yeah, if it's on your face, the facial would be really good for you because the cupping, we focus on lymphatic drainage.
Okay.
So it's helping the body to drain anything that might be stuck and providing like new blood flow to the area, which blood has so much nutrients and healing properties to really flush it. I would say after a couple of days should feel better. You notice the difference.
Yeah, I gotta try that.
Yeah.
The facial so bad.
It's so good. I love it.
Facial
Yeah, I know.
It's like so
It's
relaxing.
good. I know.
Yes. Well, this was so great chatting with you. I've loved learning so much about Temple. This is like the place for me. I can already tell because it's everything that I love kind of combined into one. And I love that you focus more on lifestyle changes than just quick fixes and things like that. And it seems like you've built a really amazing community.
Thank you so much.
Of like-minded people. So
Yeah.
I'm excited to come back. And thank you so much for joining Ask an Expert.
Yes, thank you for having me. It was a pleasure.
Awesome. I'm so excited.
Yay.
So we are actually going to do a little treatment today. I'm so excited. I brought my sister-in-law here, and we're gonna give her some acupuncture, maybe some gua sha, right?
Yeah.
I can't wait.
Sounds
Let's
fun.
see what it's like.